Hello everyone, welcome to Your Health in Your Hands and welcome to the year 2020. My name is Dr. David Ajibade and I'm the founder and director of the Brain and Body Foundation. This is Your Health in Your Hands, and as we've been saying over and over and over again for the past 1 year plus, that a lot of what's going to happen to your health will depend on what you do and what you say and how you interact with others and how you use medication, how you interact with the healthcare system. And we felt that going into this year, we really want to take a more holistic approach and really point out things that we feel that you need to know about. If you remember, we talked about in fact, how we started. And the main point when we started this program, or when we refreshed this program, because Your Health in Your Hands has been around for a while, but the main point why I got started on this was because of black people. I pointed out that black people, we all know this, seem to have higher rates of certain kind of conditions. Cancers, heart attacks, strokes, diabetes, and several other conditions. And we wanted to be able to know why and pass that message across to you so that you can know and do what it takes to take control of your health and that of your families. And by the grace of God, we've been able to, in some little way, in our little way, been able to accomplish that to a certain extent. So we're going to take it from where we left off in 2019 and push further ahead. But before we get into today's program, we're going to say a few things about our last outreach, our sickle cell disease outreach, which was again carried on and reported on by NTA. So take a listen and watch at this.
Toyin Adeshola, she's 54 years old and she has been living with sickle cell anemia. She's here to tell us her experience.
I don't want the people who are coming after us to go through the same challenges we had. There's more information out there, and that's why we provide free drugs, free consultations, and we inspire them to be the best they can be.
This free medical outreach by a non-governmental organization, Brain and Body Foundation, is in collaboration with SAMI Sickle Cell Advocacy and Management Initiative. This gesture is for residents of Surulere axis of Lagos State. People turned out in their numbers to receive free medical checks. Brain, joint and other medical checks were offered for free.
This is what they gave me for free. I didn't pay kobo.
He's been using it and ever since then, no crisis.
The primary preventive measure is for people to know their genotype, to go to a reputable organization where they can do their genotype and find out whether they are AAAS.
They need to eat a lot of folic acid, F4, all those things. Anything that has green with it, they need to eat a lot of it.
Recent statistics by the World Health Organization, WHO, revealed that 250 million people globally carry the genotype responsible for sickle cell and other hemoglobin diseases. In terms of prevalence, records shows that Nigeria ranks highest with about 20 to 30% of the population. In
Welcome back. I want to say a big thank you to NTA and to all the volunteers and people who came to support us during this program. Sickle cell disease is a big problem. I keep on saying it, and I hope you appreciate that. But we believe it has to become front and center of our national discussion. Too many kids are dying. Too many people are suffering from it. So please help us and join us in our fight against sickle cell disease, but more importantly, our fight for good health for those with sickle cell disease. All right, let's get into it. Some important points, again, that I want to remind you about. We have certain disadvantages, in addition to the fact that our genes and our diet. In terms of the healthcare system, we are not yet there. For instance, we have the rate is about 4,000 to 5,000 doctors to a patient or to an individual. In other countries, it's much less. It's much higher than that. In other words, they have like 600, 500, 600 doctors to one patient. So what does that mean? It means that many people are going to be without healthcare, adequate access to healthcare. Not only that, equipment is unavailable, whether it's equipment for treatment or equipment for diagnosis. Obviously, facilities are in short supply. The government obviously is doing a lot, is trying to make up for that, but we're so far behind that it's going to take a long time to get there unless something hugely drastic happens. So in addition to that, I'll have a low literacy rates. Drugs are a problem. Having access to safe, genuine drugs is a problem. A lot of fake drugs out in the market. So, and our climate too, we're more exposed to tropical diseases. The climate is, well, in some cases, it allows for certain diseases. In fact, quick thoughts here. I remember many of my patients with sickle cell disease and asthma, they say that for those who have the opportunity to, when they travel abroad, they say they feel better. They don't have attacks as much. Maybe just the environment, I don't know. Maybe they don't have to deal with malaria or typhoid. So the climate is also an issue. I'm saying all these things because these all compound and make it hard to actually live a healthy life. So unless you are intelligent, unless you have the right understanding and knowledge, you will pretty much get sucked on with the tide and with the current, and your health will deteriorate unless, of course, you've got maybe genes from a planet called Krypton, where you're superhuman. But for the most of us, we don't have that kind of opportunity. So we need to know what to do where it comes to our health. And that's why we're doing what we're doing on this show. So I want to quote this. It's going to be on the screen. Health is a large word. It embraces not the body only, but the mind and the spirit as well. And not today's pain or pleasure alone, but, and mark this, the whole being and outlook of man. So health involves the whole being and outlook of man. You cannot just say health is just of the body or just of the physical body. Your mental health is important. Your emotional health is important. Your spiritual health, believe it or not, is hugely important. And we want to take a look at all these things. Now, at this point, I want to mention also that we get a lot of calls and WhatsApp messages and text messages asking us a lot of different questions many times. Some questions seem to happen a lot of times, like something having to do with their reproductive organs or having an infection down there, and they want to know what to do about it. And let me just quickly point out that we cannot give you specific medical advice over the phone or by text message. You've got to have the tests done. You've got to have the lab tests done and know exactly what kind of infection you're having, and then you can get the right antibiotics and the right medications for that. It would be unethical for myself or for me or anybody else to say go and use this particular medication or antibiotic when we don't know exactly what the disease is. And besides, there are so many calls coming in that honestly, I have to be frank with you, we cannot keep up with them all. My sincere apologies. So for those of you who really want to have a one-on-one, you might have to call to schedule an appointment with us, and we will try and help out as much as we possibly can. So back to what we're talking about. If we're going to be healthy, like I said, we've got to know certain things. There are things that we know we need to do for ourselves, and there are things that the government and the external, the doctors and the nurses and the pharmacists and other players and stakeholders in the healthcare field would have to help us do. So what I'm going to do is I'm going to go to the board and I'm going to kind of like draw out a schematic of it, and then maybe we can show you areas where you fit in. But more importantly, what we're looking for now is that we want to try and get your feedback. Because we're laying out a map for the topics we're going to be treating this year. I already have in my mind an idea of what topics I feel need to be addressed well, but I don't want to leave it to just myself and the producers and directors in the studio. We want to say, what do the people want to know about? What is the pulse of the nation, especially where health is concerned. So I want to get your feedback. So as we're drawing this on the board and as we're discussing, just keep it in mind to get a note or something and just write down some of the topics you feel that you want us to address. So I think we'll just take a short break here, and then we'll be right back. All right, welcome back. Now, when it comes to health, you cannot ignore the external factors, and I'm just going to go through them in this segment. So the physical environment matters. I've alluded to that a little bit. Hot temperatures, dusty, dry can enable the spread of certain kinds of diseases. And we had the DG of the NCDC, the National Centers for Disease Control, over here, and he explained a few things with regards to that. So the physical environment is very, very important. But let me skip over to this. This is the FMOH, which is Federal Ministry of Health. Of course, they are the custodians of health. The Minister of Health is the custodian of health, and he oversees a lot of what's going on, including the insurance organization, NHIS, and all the other primary health care organizations, the AIDS, the disease epidemic control, a lot of all these things. So he controls, he oversees all that. We will be having him on sometime, hopefully very soon. We'll have him on to talk about what his plans and how he sees us going, where he sees us going and the ministry going with regards to health. The climate is important. I've kind of like said that already. Agriculture, you might think that's not important, but absolutely it is. Our food supply and how that food is processed can, to a very large extent, affect our health. I was watching a video on WhatsApp recently and how they are really pumping these livestock, especially chickens, with antibiotics and steroids. We don't know anything about that. Maybe not as much in Nigeria, but hey, if you're bringing in food from out of this country, there's a good chance they have a lot of antibiotics and a lot of steroids in them. These chemicals help them grow. These chickens and these cows grow very big, very fast. It's good for the it's good for the farmers, not good for us. We're not supposed to have all those toxins in our bodies. And by the way, we'll be talking about detoxification, going into it big time. But the food that we eat and the food we get from the market is not as clean as you may think. So we're going to have someone talk about some of these toxins and some of these additives that are added to our foods that you should know about. What else? I mentioned earlier too that healthcare professionals are not, that's what HCP means. Healthcare professionals are not in overabundant supply. We are seriously lacking when it comes to availability of doctors, nurses, physiotherapists, psychologists, and all that. So again, that calls for the importance of you knowing how to take your health in your hands. It doesn't mean ignoring your doctor's advice. It means you knowing about your body, about your brain, and knowing the things that will hurt your brain, knowing the things that will help your body to live healthier and longer. It doesn't just come easily like that. Personally, I had to do, even though I'm a medical doctor, I had to do extensive search to really find out some of the answers to these things, and that's why I'm trying to pass them over to you, or we are trying to pass them over to you. Security, that's a big issue. I was on a TV station, on a TV show, and they said, well, security takes this amount, this percentage of the government budget, food takes this amount, health takes this amount, and of course education takes this amount. And the point was that health and education, the budget for health and education was really low compared to security. And they were like, don't you think, they were asking me now, they were asking, don't you think that they should take out of the security budget and transfer to the food, to the health and the education budget? And I was like, listen, my mama didn't raise a fool. My mother did not raise a fool. So, security is paramount. If the borders break down, if this country is invaded and overrun by terrorists, we won't be saying too much about education, and we certainly won't be saying too much about health. We're talking about survival, about refugees, about all kinds of catastrophes going on. So it's really important that security be where it should be given a priority, especially in these trying times that we're in. That is not to say that health, and that is not to say that education are not important, but not to the expense or to the detriment of security. So security is really important. We also need the establishments, the physical locations where people can go to and receive healthcare, their healthcare needs met, whether it's for lab tests. Remember, we need to know what is going on in your body. And everybody treats themselves for malaria. Everybody knows which kind of anti-malaria works. Again, the head of NCDC came over here, and he came to explain that that could be a problem, because sometimes you're treating yourself for malaria. Meanwhile, you have another healthcare condition. It could be an infection that you need to treat rather than malaria. So it's very important that there be establishments where you can have adequate testing done, and that testing be the basis for which you can be treated. Again, these are lacking in this country for many people, especially those in remote areas. So it brings us back down to what we'll be talking about in the next segment, which is what you need to do. And I'm going to point to them when we get back. So don't go away. All right, welcome back. In the last segment, we talked about the external factors, things that you have less control over because it has to do with the government, it has to do with the environment. We're going to talk about the things that you have more control over. These are more like the internal factors. So let's just quickly talk about this. Most of them we've talked about them before, but I just need to emphasize them, because based on the fact that we don't have access, or most of us don't have adequate access to hospitals, to doctors, to the right drugs, it's incumbent, it behooves us. Let me look for another word. It's critical that we, as citizens of Nigeria, people who live in Nigeria, learn the basic fundamental principles that govern health. And you can't get more fundamental and basic than diet, what you put in your mouth. And we talk about that a lot. I think that's the easiest thing to address. It doesn't mean that you have to stop eating pounded yam or fufu, but I'm saying that there are things in your diet that are missing, and so we need to add some things to it. So some of them you might need to supplement, and some of them are cheap enough. I would say everybody needs to take vitamin C. I would say everybody needs to take vitamin D, again, because vitamin D, we black people are deficient in vitamin D. It's a proven fact that we need more vitamin D than probably the white person does. So we need to take more vitamin D. Hygiene, dental hygiene, we've talked about things like your teeth. We know that if your teeth or your gums are unhealthy, there's a good chance it's going to affect your brain. It can predispose you to things like cancer and cardiovascular disease. Brush your teeth twice a day, morning and evening, at least, please. And of course, you need to floss as well. Exercise, I think there's no more important law than movement. If you're moving, you're alive. If you're not moving, you're dead, pretty much. And the more you move, the healthier, as a rule, you will be. Most of us, when we turn 30, we just tend to slow down and don't really care about a lot of things when it comes to exercise and movement. But I'm telling you, if you can get that part taken care of 2 to 3 times, maybe 3 to 4 times a week, some kind of exercise for about 30 minutes or more, you will be doing your body a world of favor. Relationships are extremely important as well. We are a society that we're quite good at that. We value that connection we have. We're not too far removed from the days when we used to sit around the campfire and tell stories. I don't remember that ever happening to me, but I think that's what we used to do under the moonlight, of course. So relationships are extremely important. They are now finding out clear-cut relationships, clear-cut correlations between loneliness and even damage to your genes, damage to your DNA. So if you're lonely for an extended period of time, it can put you at the risk of chronic diseases, believe it or not. Your thoughts and emotions are important, your words. Now remember, can you remember what we categorize this under? It is the opinion of those who best understand the physical system that if the physical laws were strictly observed from generation to generation, there would be an end to the frightful diseases that cut life short, and of the long list of maladies that make life a torment or a trial, and that this wonderful machine, the body, this goodly temple, would gradually decay, and men would at last die, as if gently falling asleep. I love this quote by Mrs. Shedwick because it so captures the entire principles when it comes to the laws of life. And of course, I'm not saying that as long as you eat healthy and you sleep well, that you will absolutely not have any disease. Of course not. But I'm saying that you have a greater chance of living a longer life. And also, you have a greater chance, if at all you have a sickness or a disease, you have a greater chance of recovering from that sickness and disease when your doctor is treating you adequately. Because a lot of medication, a lot of treatment, whether it's surgery or radiotherapy when it comes to cancer, a lot of the success of those depend on you observing these fundamental principles. These ones I've kind of pointed out to on the board, and again they will be on your screen as well. The 7 laws of life, which basically says that the quality of your life depends on the quality of your words, and so on and so on and so forth. If you don't obey these laws, your health can really never really be optimal, because the more you disobey them, the more your health will suffer. Again, these are not principles, they're not steps, they're not even rules, because rules can be broken, laws cannot. So these are the things that we really will be talking about this year. The internal factors, the ones you have control over, the external factors, the ones you don't have control over. And of course, I'm going to be bringing in a lot of guests to talk about these different topics. Mental health, absolutely. We live in an environment in Nigeria where we're being assailed from every angle, from the northeast, the Niger Delta region, the Middle Belt, the herdsmen fighting against the farmers, and vice versa. We are under a lot of stress, and I'm telling you, in the next 5 to 10 years, you will see a lot of these mental health issues come to the front. If at all they're not coming out already, there'll be much more. So it just is so important that we understand how to safeguard our mental health. We understand the things that can affect it, and we need to understand the things that we can do to to build resilience, and to build mental strength and energy, so you can overcome it. Another thing that we are working with the Federal Ministry of Health with is aging. Our population, we're now surviving past 50, surviving past 60, surviving past 70. We're dealing with an aging population. We will start dealing with an aging population. Still have a lot of young people, but more and more people are getting older, and we don't have as much in place. So it's important that we understand the things that affect the older people and how we can safeguard their health or improve their health. So it's those are other things we'll be talking about. But please, again and again, we have to wrap up at this point, but send in your suggestions, your comments. We would really appreciate it. We will not be able to address all of them at the same time, all of them at once, but we would appreciate it if you send in your comments. As always, we will be talking about the tip of the day or tip of the week. So the tip of the week is that please spend some more time in the sun. If you have a nice backyard where you can walk around, I would say take off your shirt, wear shorts, walk around. If you're going to Jabi Lake Park or the park and all that, I know you have all these nice designer tops and wears that you can use to shine and all that. Wear shorts this time, okay? And you'll be glad you did, because sunlight is so important. Okay, this kind of like wraps things up for the show. Wishing you the very best of 2020, and we will see you next week. God bless.